Good morning, my little chickadees. Here I am in all my glory, going to the dentist. Yes, going to the dentist. Okay, y'all don't need to see my waggle. I'm working on that. Well, I had an eventful night, uneventful rather. I watched the Housewives reunion, and it's not my place to comment. That's not what my channel is about. It's about vlogging my diabetic life. So we're going to move on to that. Good oral care is good for diabetics. You have to go to the dentist every 6 months for cleaning, or you're supposed to, or your insurance is supposed to allow you to do that if you have a diagnosis for diabetes. So of course I power washed my mouth. But I do sit with a toothbrush near to me while I'm just watching TV or whatever. And I'm always checking for rough patches. You know what that is. Missed plaque. Because I was in a hurry and I need to change the head on that electric or micro whatever toothbrush. So there's a missed patch back here. But that water flosser does the trick. That turkey bacon I had 1 piece of turkey bacon, 2 poached eggs, and way more than I needed to have of fried potato puffs. Tater tots. And oh God, it was crispy and good. Hard, like I like them overdone. Yeah. So I'll see you guys when I come out, because I'm sure they don't want me taping in there. Okay. I told you. You change your diet, you change your life, that's great. But you're going to end up in here a lot. Hey, that was nice. My dentist makes it pleasant and relaxing. Because I'm like a cat stuck to the ceiling most times. But she makes it nice and relaxing. Her and the, I don't know the proper titles, but her and the dental assistant or dental tech, well anyway, the person that assists the dentist, they had a nice conversation about children and beaches, and it was nice. It was just so nice, because I'm just full of trepidation for no real reason over needle sticks and dental, and that's not my problem. I don't have issues, but I have unfounded nervousness, unfounded, and it's, you know, who wants to be delusional about stuff? I don't. So that's done. Okay, the next on the agenda, oh yeah, it's always a bunch of stuff. Next on the agenda, I need to get a background check for my job. Yes, every so often they do a background check to make sure you still all right, everything's still kosher. So we're gonna go do that. I'm still just going to sit here for a minute. As you see that, you'll probably see the inside of every bathroom, every place I ever go, as long as I have my eating habits the way that I do, and have increased water intake and drinking green tea and whatnot. You're probably going to go and see every bathroom because that's everywhere I go. There's a bathroom I'm going in. So I keep supplies on hand. This, I just keep the peroxide just for general sanitation of mouth. And this is, I got this from the dollar store. Just spray it. Especially when you come out of places, spray it on your steering wheel. Use it. And I believe it cuts down on germs and the transmission of disease, that's the whole goal of it. But yep, every 6 months you're supposed to have I'm trying to open my eyebrow thing. Every 6 months you're supposed to have a cleaning. If you're diabetic, it's every 6 months or more often. It's whatever the doctor says. You need a doctor's intervention in that particular area. because your teeth, oral health affects your heart, and diabetes affects your heart. Negative impact on your heart, negative impact on your heart from infection in your gums and teeth, which comes from careless dental hygiene. And she really had to scrape, so I'm not really one to talk. I did that quick power wash, but that don't take care of all that years where not years, but months where I was lax. And that's what it is. I was lax for months. And I had got out of the habit with my toothbrush. I just keep a toothbrush near me so I can just brush on my teeth as I feel the smoothness go away. You know, you get that smoothness after you brush. I like that smoothness. And for breath, I have the peroxide. I use peroxide orally for good oral health. A girl told me in college, that's what her dentist told her. So I started brushing with it and using it, and I believe it's helped over the years. And I'm passing it on to you. So, yep. If you're diabetic, you need to keep up with your dental appointments. Okay, on to the next one. Now, y'all know I can't tape in the government building. I'm sorry. Out the way. I don't even know if I'm in the right building. Well, we have a rain garden. I don't even know if I can take this phone in there. What about you take that? You need some help? Okay. Let me turn this off. All right. Back out this door. Drive around to the sheriff's department. Man, I always get the buildings wrong. It's 3 buildings. One of them is a jail. The county jail. Or county lockup, whatever you call it. This is the courthouse, government building. I don't know. But I just need a background check, so that's something different. So. My teeth feel good, but I'm going to get me some Praxa brushes. I noticed that my dentist had to scrape a bit between the teeth. That sticky residue, that's plaque. I'm going to go get some Praxa brushes. And I'm going to show you guys. Do what you can when you can, because it might be to the point where you don't want to do nothing but lay down. So when you got some energy, do what you can while you can. To make up for the parts when you just want to lay down somewhere. Alright. And I move like I'm 800 pounds. My feet are hurt from the exercising them for ballet. There. Alright. We at the gym. We at the gym. We got the background check. And I'm out this way, so I made that promise to myself. Go to the gym when you're out that way. Go to the gym when you're out that way. Because I'm out this way, frequently enough. Go to the gym when you're out this way. Because if I had money, I would go shopping. Go to Bed Bath & Beyond. This is a shopping corridor out here. But work within my means and stick to the promises I made to myself. And go in the gym. since I have some time. But I did not have to go to the bathroom in the sheriff's department, the county building. But I know I'm going to be in it here. I'm telling you. Change your diet. Change the way you eat and all of that. And increase your water intake. And make sure you have some alcohol spray and hand sanitizer. Or actually, what's best is the packets of bleach towelette, the Lysol bleach towelettes. And go from there. It's just something I got to deal with. So, off to the races. Hi. I mean, it's Mac. I'm finally back. Yeah, I was eating. So we went to the dentist. We went to the sheriff's department. Then I went to the gym. And I worked on my core for 45 minutes. Then I had some work stuff. And then I came home. And I've been home for about almost 4 hours. 3 hours and, excuse me, 45 minutes. Excuse me. Long enough for me to clean up and, do mama stuff. Now, about 15 minutes ago, I made me a salad. I know it may not look like much, but those little dots, this is sprouted quinoa. I just sprouted them in some really, really, really warm water. If you soak them and put them in warm water, they'll sprout. Boiled egg, spinach, what kind of lettuce is that? I'm going to say Radcliffe. That's not it. It's not radicchio. It's not that. It's romaine lettuce, which I always thought was bitter. It's not. It's sweet. This must be the time to get green stuff because the spinach was really good looking and wasn't all wilty. Everything is good. Oh, I made some turkey bacon to put in here, but I forgot because I was starving. Oh, and some sugar snap peas. My favorite. I eat those raw. Like, why cook them? Now, I just looked on YouTube and found a green goddess recipe. Was it Chef John? I used this recipe. Whizzed it up in the Ninja. That's good to go. Yep, I also had a chicken breast patty. But I didn't eat it with bread because the nutritionist at the hospital told me that the breading on your cutlets or whatever constitute 2 pieces of bread. So, I'm not really a bread person. I like good bread, like a Panera bread or those delicious loaves of bread, fresh baked at Walmart, but I don't have to have bread. I just ate the chicken patty. Or you can cut it up, put it on the salad. I hadn't made the salad. Those damn potato puffs, they tripping me up. Y'all was there when I bought them. You knew that was wrong when I was getting it. I knew I was wrong. You all know I was wrong. See, I like making my own salad dressing because I didn't use lemon juice. I used my kombucha, which I need to pour into the jar and stuff. I'm going to put that off too. I'm going to put that off. It's a lot of work. I use my kombucha so I can get the health benefits and the probiotics on this nice, delicious, cold, raw salad. And I used more garlic than I was supposed to because garlic is good for you and I like it. And I'm going to be pretty much around the house tomorrow. So, because the garlic comes through the pores. Now, I have some good news to report. While stretching, I discovered that I can almost get into a split. And I did that by stretching, I guess, every other day for about a week, just staying on it. No, this whole month. I take that back. In the pool, if you're in the shallow end, and if you just go into a split, now you're going to be dunked under the water. Please hold your breath. If you can't swim, don't do this. See, I can swim. Okay? And I know when to come up for air and all that. If you can't swim, don't follow anything I'm telling you. But in the pool, because it displaces my weight, everybody's weight, especially saltwater pool, I'm able to do demi-point and barefoot on point, because if you go into 5 feet of water, it's displacing quite a bit of my weight. That must be how it feels to be thin. Not feeling. Only in the pool. But for me, so that's what I did. I just kept going into split to stretch those sets of muscles, and that's what I do in the pool. To do any ballet, anything, I do it in the pool because it displaces my weight. And you really need to be strong and thin. You just don't need to have extra weight, you know, especially and I don't want to hurt anything. So I just do all that stuff in the pool, and it's better for me. And I worked on a leg press. I worked on, I don't know what it's called, the 2 things, and you just pull that. But when I went to go stretch, I looked in the mirror and I'm like, the exercise machine was blocking my full view, but it really looked like I was in a split. But I knew I was leaning to one side. I wasn't actually in the full split, like boom. You know, and that's what I'm looking for by my birthday. By July, I want to get into a full split. From standing to split. Not getting down on the floor and, you know, stretching for like an hour. But I think if I stretch every other day like I've been doing, I might make that goal before my birthday. I like setting goals. It makes me feel like I'm accomplishing something. Even though, maybe. But do you guys want to make some bath bombs? Okay, well, I'll see you over in bath. Hi, this is Lala and DIY Life Hack Mama. Please subscribe to DIY Life Hack Mama and Lala McLeod and Lala. Subscribe to all 3 of my channels. And don't forget to thumbs up the videos. Thanks, and comment below. Bye.